I originally thought that I was going to do sports orthopedics because I was an athlete, and then in residency I ended up getting to do a lot of spine surgery and involved with patients, and realized that I really liked those surgeries and I really liked the patients and really was able to connect. And there's actually very few women who do orthopedic spine surgery, and so I sort of saw that as a little bit of a challenge and love it. A lot of times we think of orthopedics as just looking at the structure, but the reality of it is, if we're trying to figure out what's wrong with a patient, there are a lot of things, for example, that can cause pain in the hip and the spine and the pelvic area and even down into the legs. So there is lumbar stenosis, which is where there's less room for the nerves, and that's a spine-related issue. But there are also things like statin medications that a lot of people are on that can cause symptoms that mimic spine-related problems. And then if blood sugars are elevated, even in somebody who doesn't have diabetes or obesity, that can cause these sugars to get stuck to tendons and ligaments, and those things can mimic problems related to the spine. So if we're trying to get a patient better, we really want to look at what is the underlying cause of the problem. And then the other things that we find are that a ketogenic type diet can actually be very anti-inflammatory, because some of those ketones that are produced decrease inflammation in the body. So we can use those things as tools even when patients have spine-related issues, and also to improve surgical outcomes, decrease pain, speed up healing by using these different dietary approaches. There are two sort of fun things. One of them was I was in a documentary, Fat, Sick, and Nearly Dead, where we talked about nutrition and how we can use nutrition, in our case, to improve my own health, but also, what we do with our family and different things. And there's different strategies. So, there are different ways to increase the plants that you eat and healthy fats and things like that. And the one other little fact about me is I'm a type 1 diabetic. And while some people see that as a really negative thing, I've been able to use that to learn how to really dial in my own health and to then translate that to help patients with their health. And I'm very involved in a lot of the research that goes around type 1 diabetes.